You know, your eyes are two of the most precious organs of your body. We need them to basically see what we're doing. And we get to the point sometimes where we have some issues with our eyes, so we want to reach out to a great eye doctor. Well, Dr. Clayton Stevens here on Pass Road in Biloxi is an eye doctor, and we wanted to come and talk to him and find out more about his business here. How are you, sir?
I'm doing good, thank you.
Well, good. Tell us a little bit of background about yourself first, if you would, doctor. I mean, you are from the coast.
Sure, yeah, I grew up here. I grew up in Long Beach. Went all the way through school at Long Beach, and then I went to college at Mississippi College in Clinton. Did my undergraduate there. That's where I kind of first became interested in the vision system. Decided I wanted to do medical school and did that in Jackson at the University of Mississippi Medical Center. After finishing there, I went to Tulane to do residency, specifically in ophthalmology. And from there, I took a job out in Texas for a year and a half, and then came back to the coast beginning of 2019, and ultimately opened this practice earlier this year.
That's awesome. Well, welcome back. Welcome home.
Yeah.
Just say that. Welcome home. Tell us about eye care in general. I mean, it's something that we all should all do. I mean, I know there are some people that are born with vision defects, but the older that we get, I mean, there has a tendency for things to have issues. But you work a lot with different people and different issues.
That's correct. You know, we see a full range of patients, people with urgent eye issues, injuries, sudden changes in their vision for various reasons, as well as the routine checks. And, you know, we'll see really throughout the course of your life and kind of follow you all the way through dealing with issues as they come up.
Now, one of the things I know that you're really proud of is your website, because I mean it is so easy to navigate. It's full of information. I enjoyed looking through it myself. But one of the other things is the portal that y'all use for patients. So we want to show you that next here at Dr. Stevens' office on Pass Road in Biloxi. Show us your website if you would.
Sure. So this is the home page. Some of the usual tabs up across as far as the portal where you can get your information from your visits here, as well as online bill pay, ways to contact us. And then a nice feature we have is you can request an appointment, even as a new patient, right on here. We've got our schedule and available time slots. This is for
it's like picking the seat in the movie theater. It lets you know what's open and what's not.
That's right. Just some basic information over here on the left, and then anything you want to put us in the comments and request, and we'll get a notification of your request, and we'll confirm online. And so nice, simple, easy way to get an appointment without having to sit on hold for.
I was going to say that can be aggravating at times when you're trying to call in if it's an emergency and the phone is ringing, and doesn't answer, or as you said, you get stuck on hold for a while.
Yeah, exactly. You know, one thing we've certainly aimed to do is make it a convenient experience. We aim to respect your time. You know, I don't feel that my time is more valuable than yours, and we try to limit wait times through efficient ways of scheduling and handling the office procedures.
All right. Well, let's go back and we're going to show you an eye. Now, you didn't really think we were going to show you an actual eyeball, but this is the eye chart. So talk about this and some of the things that you deal with.
Yeah, so some of the most common conditions that I tend to treat, maybe the most common is cataract, which is when this lens here in the front part of the eye begins to change color. That is technically what a cataract is. For most people, that's mid to late 50s, and a continual process that eventually turns color enough to where you can't see as sharp as you would like, even with your glasses. And so cataract surgery is something I do very often. It's the most common surgery in the United States, again, because it happens to everyone.
And what would you say the symptom was for that? It just things just start going out of focus?
Right. It's a very gradual change in your vision or worsening in your vision, and it's usually not a surprise. It's something that's diagnosed and followed for several years before it becomes a problem enough to want to undergo surgery.
Okay.
Another couple common issues deal with the back part of the eye. This kind of orange layer here is called the retina, and that's where diabetics can run into trouble. You can see on the image, very vascular in the back part of the eye, and that's what's affected by diabetes. So always like to stress that diabetics should get their annual checks at the very minimum. Just like anything, the earlier you catch those problems, the better off you'll be for sure. Diabetic retinopathy is a leading cause of blindness in the working age population.
And of course, Mississippi's #1 in diabetics, so
correct, yeah.
there's an issue there.
So always a good thing to stress upon people. Another issue is glaucoma, which is a condition that affects this optic nerve, and that transmits the electrical signal back to your brain from your eye. So glaucoma can be a scary condition because similar to high blood pressure, it's a silent disease, meaning you don't have symptoms until the very end, and that's why it can be scary. It's something that I deal with quite a bit. One of the more or newer techniques surgically to treat glaucoma is with something called the eye stent, which is the smallest stent ever placed in the human body. And if you look closely here, this tiny little speck is the actual stent, which you can't see with the naked eye.
No, I can't.
And that is done at the same time as cataract surgery. And it goes in this tiny space here. It's actually 2 different stents in that tiny space, and it's often very effective at reducing the eye pressure, which is the main goal of treatment for glaucoma.
Now, you said there's really no symptoms until it's too late for that.
Correct.
I guess as you get older, it's best to come and get your regular checkups to be able to detect it. Excuse me.
The American Academy of Ophthalmology recommends everyone 50 and older get annual checks. For high-risk people for glaucoma, such as African Americans, people with family history of glaucoma, it should start early 40s. And again, it's scary because it's not symptomatic, and it can be easily diagnosed at your eye checks.
We got about a minute left, Doctor. What's the youngest that someone should start, bringing their kids in to get their eyes checked, and what could be some of the symptoms that they say, little Bobby's vision might not be as good?
Yeah, so school systems have come a long way as far as screenings at kindergarten age. Beyond that, certainly any eye turns, sometimes just what seems to be clumsiness can be due to poor vision, and parents will notice that maybe one or both eyes aren't tracking things as well as you would expect. And it's never a bad idea just to check to be sure, even if you don't see any problems.
Dr. Stevens, tell us the hours that you're open, if you would, please.
Sure, we're open Monday through Friday, 8:30 to 4:30. On Friday, we close a little early at 3 o'clock.
Okay, and of course, if they want some more information, you want to register, go to Stevens Eyes.
StevensEye.com.
All right, and of course the portal and everything's in there. You can set up your own little profile, make an appointment, and so easy. So again, thank you so much, and again, welcome home.
Thank you.
All right, Stevens Eye Care. They're located on Pass Road in Biloxi.